Welcome back to KETK's East Texas Live. Joining us in the living room now is Holly from CHRISTUS Trinity Mother Francis Lindale HealthPark. And today she's going to tell us about flu for children. Good morning. More about prevention and getting the vaccine.
That's right. So we're coming up on flu vaccine season. Flu usually starts in October and lasts through the end of May. And so it's really important that you go and get your flu vaccine before the season starts, because it takes about 2 weeks for you to build a good immunity to the vaccine to be protected before flu season comes around.
So why is it so important to get the vaccine, and who should really get it?
So really, it's recommended that everyone over the age of 6 months receives the vaccine, especially people that are going to be more at high risk. Those are going to be children under the age of 5, people over the age of 65, pregnant women, and then anyone that has chronic medical problems such as asthma, diabetes, congenital heart disease, things like that. They're much more at risk of high risk for complications, so it's really important that they get protected. And flu is a much more severe illness than your typical common cold. You know, you're much more likely to get ear infections, sinus infections, pneumonia, dehydration, and every year there actually are cases of flu-related deaths, even in children. So it's very important that they get their vaccine to prevent those complications.
So you brought up children. Do children and people, you know, the elderly, do they get a different set of, how does it work for them? Does it work any differently than for the average adult?
They do. So children under the age of 3 actually get a little bit smaller of a dose than children above the age of 3. And then in adults over the age of 65, because their immune systems don't function as well, they actually get a little bit of a different flu vaccine to help them mount a more robust immune response and to keep protection throughout the season.
So I've always heard, I want to go ahead and ask about this. I've always heard that, oh, you know, well, if you get the flu shot, you might get sick. Is that really true? Do you get a little sick?
No, that is actually, you know, the one that's recommended this year is not a live vaccine, and it is impossible to get sick from that vaccine. Now, it does cause your immune system to turn on and mount a response, and so sometimes that makes us not feel as well, maybe a little bit achy, a sore arm, but that you absolutely cannot get the flu from the vaccine. It's very safe.
Now, another rumor that goes around, some people say, well, you shouldn't really get the flu shot right now because what if it doesn't last all throughout the winter? When should people get the flu shot?
It's really recommended to get it as soon as it becomes available, which is usually early September, and to get it done by the end of October before flu really starts circulating around.
Now, can there be any complications from the flu?
Yes, so, you know, like we said, you can get ear infections, sinus infections, pneumonias, complications of if you have chronic medical problems, as well as, you know, those few people that end up dying from the flu.
So, are y'all offering the flu shot at CHRISTUS Trinity Mother Francis?
Yes, we started offering the flu vaccine in September, and we'll continue to do so throughout the whole flu season. And like I said, that's from, you know, October through the end of May. We'll be providing that to the community.
So exactly where can people get the flu shot right now? Is it available at all y'all's clinics?
It is available at any of the Trinity Mother Francis clinic. And like I said before, we're not doing the live nasal vaccine this year just because it is not recommended. They've gone back to do research, and the last 3 years it has not been effective, and so that will not be offered in this season.
All righty. Well, thank you very much.
Thank you much for having me.
All righty. We'll be right back.